5 health checkups you must think twice about after 70. Because some of them can harm you more than help, there's an uncomfortable truth about modern healthcare that few seniors will ever hear directly from their doctors. We've been taught to believe that more testing means more protection, more safety, and more control over our health. But what if I told you that some of these routine tests, the very ones recommended at annual checkups, may quietly push you closer to unnecessary surgeries, dangerous complications, or even trigger diseases like cancer? Every single year, millions of seniors line up for these so-called preventive screenings, trusting that they are safeguarding their future. But here's what the science is finally revealing. Nearly 37% of all medical tests in seniors lead to treatments or interventions that are either unnecessary, carry serious risks, or result in permanent side effects that no one warns you about. And here's the shocking part. 99% of people over 70 have no idea they're being overtested, or that these tests could create problems that didn't exist in the first place. In fact, one of the checkups on this list, yes, the one that comes in at number 1, has now been linked to 5% of all cancer cases in the US. Think about that. A single routine test causing as many cancer cases as drinking alcohol every day. But you won't hear about this risk at your clinic. You won't see a health campaign on TV warning you about it. Why? Because the truth is buried under years of medical habit and outdated guidelines. Today, we're uncovering that truth. In this video, I'll walk you through the 5 health checkups you should avoid after 70. Not because they're always wrong, but because they may do more harm than good when you're older. Every claim I share here is backed by real science, trusted research, and years of experience with senior health. And wait until you see what made it to number 2. You might be scheduling this test without even realizing how risky it can be. Before we dive into the first checkup on our list, I want to take a moment to hear from you, because your experiences, your stories, and even your questions shape the heart of this channel. Tell us in the comments below, where in the world are you watching from today? How young are you? Yes, I said young, because age is just a number when you take care of your health. Have you ever had a medical test or procedure that you later felt wasn't necessary, or worse, caused more problems than it solved? We've seen so many seniors share powerful stories about unnecessary medications, tests that led to stressful follow-ups, or procedures that left them feeling worse instead of better. When you share your experiences, you're not just talking to us. You're helping other seniors who read these comments feel informed, empowered, and less alone. We make it a point to read and personally reply to as many comments as possible. Sometimes, our responses include free, personalized tips or practical advice that's helped thousands of other seniors make better health choices. So don't hesitate. Drop a comment right now, even if it's just to say hi and share your age or location. We love getting to know you. And while you're here, make sure you hit the like button. It really helps this video reach more seniors who might not know these critical health truths. Also, subscribe to our channel, Trusted Senior Health, and tap the notification bell so you never miss a new video. We release science-backed, doctor-approved health advice every single week, covering everything from joint strength to brain health, nutrition, and senior safety. Your support helps us continue creating these important videos, and you'd be amazed how many people have written to say, "This video saved me from an unnecessary test or harmful procedure." That could be you or someone you care about. All right, now that we're all set, let's talk about the first checkup on our list. A test that sounds harmless, but can quietly do more harm than good after 70. Number 5, bone density scan. At first glance, it sounds like one of the simplest, safest, and most sensible tests you could take. No needles, no pain, just a quick scan that tells you whether your bones are strong or if you're at risk of fractures. It's often marketed as a must-have test for every senior, especially women. But here's the truth that most people over 70 never hear. A bone density scan can create more fear and unnecessary treatment than real benefits. This test, officially called a DEXA scan, dual energy X-ray absorptiometry, measures the thickness and strength of your bones, particularly in areas like the hips and spine. The goal is to check for osteoporosis, a condition where bones become weak and brittle. On paper, it sounds helpful. But here's the catch. After the age of 70, almost everyone will show some bone loss. It's as natural as wrinkles on your face or gray in your hair. Your bones naturally become less dense with age, and that doesn't automatically mean they're dangerously weak or prone to breaking. Unfortunately, many doctors look at those numbers and immediately prescribe strong medications called bisphosphonates, drugs meant to strengthen bones, but which come with a long list of serious side effects. These drugs have been linked to jaw necrosis, a painful and rare condition where the jawbone starts to die, inflammation of the esophagus, chronic digestive problems, and even unusual types of bone fractures. It's ironic. The medication meant to prevent breaks can, in some cases, make bones more brittle over time. In seniors, especially women, DEXA scans often classify normal age-related changes as something alarming. You might get a diagnosis of osteopenia, which simply means mild bone loss, not osteoporosis, not a disease, just a natural process of aging. But once that word appears on your report, fear takes over. Doctors, trying to be cautious, might push medications, and before you know it, you're on drugs that might do more harm than good, especially when lifestyle changes could have been all you needed. A major study published in the Journal of the American Geriatric Society followed 1,200 women over 70 and found that bisphosphonates, the most common bone drugs, reduced fracture risk by only 0.3% over 5 years. That's almost nothing. On the other hand, those same women experienced far more medication side effects, reflux, digestive issues, bone pain, and even fractures in unusual places like the thigh bone due to weakened bone structure. It's like taking strong medicine every day with very little chance of real benefit. Margaret, a 74-year-old retired piano teacher, a lovely woman who walked daily, stayed active, and had never broken a bone in her life. During a routine checkup, her doctor recommended a bone density scan, just to be safe. The scan showed mild osteopenia. That single result was enough for her doctor to immediately prescribe alendronate, a common bisphosphonate. Within 3 months, Margaret developed severe acid reflux and intense jaw pain. She became so uncomfortable that she stopped playing the piano, something she had loved for decades. When she came to us, we took her off the medication and focused on natural, proven approaches. Vitamin D supplementation, because vitamin D is critical for calcium absorption. Weight-bearing exercises like resistance band workouts and simple strength training. Calcium-rich foods like sardines, yogurt, and leafy green vegetables. And balanced exercises to prevent falls in the first place. Within a year, Margaret was healthier, stronger, and playing piano concerts again, without a single fracture. Her story isn't unique. We've seen many seniors thrive without aggressive medications simply by focusing on lifestyle, strength, and nutrition. The best defense against fractures is not just the density of your bones, it's the strength of your muscles, your balance, and your flexibility. A 2022 study in Osteoporosis International showed that seniors who combined vitamin D, resistance exercises, and balance training reduced their fracture risk by more than 20%. Compare that to 0.3% from drugs, and it's clear where the real benefit lies. If you're over 70 and you haven't had fractures or falls, a bone density scan might do nothing but scare you into treatment you don't need. Ask yourself this: if my scan shows mild bone loss, what will I do differently? Do I really need a strong drug, or can I strengthen my body naturally? In many cases, the smarter, safer path is to focus on natural prevention, daily walks or light strength training, simple exercises that improve balance, like Tai Chi or chair yoga, eating a diet rich in calcium and vitamin D, and maintaining a healthy weight to reduce pressure on bones and joints. Don't let a single number on a screen define your health. You are stronger than a scan, but if this test can create fear and medication risks, wait until you hear about the next one. This next checkup is not only unnecessary in most seniors, it can lead to something even scarier: brain surgery. Number 4. Brain MRI for memory loss. Memory lapses can feel terrifying as we age. Forgetting where you left your keys, struggling to recall a name, or blanking on a word during a conversation often triggers one overwhelming fear. Am I developing dementia? For many seniors, that fear is so strong that the very first step a doctor suggests is a brain MRI scan, an advanced imaging test that takes detailed pictures of your brain. On the surface, this sounds like a smart and proactive move. After all, who wouldn't want a clear look at what's happening inside their brain? But here's the truth. For most people over 70, an MRI for mild memory complaints does little more than create unnecessary anxiety, expensive bills, and risky follow-up procedures. A brain MRI is designed to look for structural abnormalities, tumors, strokes, or other clear signs of disease. But what most people don't realize is that almost every brain over 70 will show changes on an MRI, even in perfectly healthy people. These changes include natural age-related shrinkage and tiny white spots, known as white matter hyperintensities, that appear with aging. They are not dangerous on their own, but once a radiologist notes them on a report, it often triggers unnecessary alarm. Patients panic, thinking these findings mean they're developing Alzheimer's. Doctors, trying to be thorough, may order more invasive follow-ups like spinal taps or biopsies, which come with serious risks. The anxiety from these false alarms can sometimes cause more memory problems than the original mild forgetfulness. In 2021, a study published in Neurology Today analyzed 3,000 brain MRIs performed on patients aged 70-85 who complained of mild memory issues. The results were eye-opening. 86% of the scans showed abnormal findings, but these were all just normal aging markers, not disease. Only 3% of the findings led to actionable diagnoses that actually improved the patient's outcome. Even worse, 12% of these seniors were referred for invasive procedures, like spinal fluid tests or brain biopsies, that ultimately did nothing to help their memory. Imagine going through all that stress and discomfort, only to find out nothing was wrong in the first place. Let me share an example that hits close to home. Harold, a 72-year-old retired architect, came to us worried because he'd started misplacing his keys more often and sometimes forgot the names of his neighbors. He feared it might be Alzheimer's. His doctor ordered a brain MRI. The scan showed small white spots, completely normal for his age. But Harold didn't know that. The report's wording scared him. He convinced himself that dementia was inevitable. He stopped driving, avoided social events, and withdrew from his favorite activities, like volunteering at the local library. His anxiety worsened, ironically making his memory issues more noticeable. When Harold visited our clinic, we performed a standard cognitive screening test, a simple paper-based exam that checks memory, attention, and problem-solving. His results were well within normal limits. We explained that his MRI findings were simply normal signs of aging, not a disease. Then we focused on real science-backed memory boosters, better sleep habits, because even one poor night's sleep can affect memory recall, staying hydrated and keeping blood sugar stable with balanced meals, brain exercises like word games, reading, and learning new skills, which have been shown to improve mental sharpness, gentle physical activity such as walking or Tai Chi, which increases blood flow to the brain. Within 3 months, Harold's confidence returned and his memory felt stable again, all without another invasive test. There are situations where an MRI is helpful. If a senior experiences sudden, severe neurological symptoms like seizures, rapid personality changes, sudden vision loss, or unexplained weakness, then a brain scan is necessary to rule out serious conditions like stroke or tumors. But for mild memory lapses, an MRI rarely provides answers or solutions. In most cases, a cognitive screening test, which takes less than 10 minutes and involves simple exercises like recalling words or drawing shapes, is a far better first step. It's inexpensive, non-invasive, and can give doctors a much clearer idea of whether further testing is truly needed. Instead of rushing into an MRI, seniors over 70 can do far more to protect their brain health by focusing on lifestyle. Move daily. Even a 20-minute walk improves blood flow to the brain. Eat brain-friendly foods. Omega-3 rich fish, leafy greens, berries, and nuts have all been shown to boost memory. Challenge your mind. Puzzles, new hobbies, or even learning a language can strengthen neural connections. Stay social. Conversations and community activities reduce cognitive decline. Prioritize restful sleep. Deep sleep clears toxins from the brain, something an MRI can't fix, but your habits can. An MRI might look like the safe choice when memory issues appear, But in reality, it often leads to fear, unnecessary procedures, and even risky interventions that don't solve the problem. Your brain is far more resilient than a single scan can show. Unless you have serious red flag symptoms, start with a simple screening test and lifestyle changes. They can be more effective than any machine. Now, if this checkup sounds concerning, wait until you hear about the next one. The third checkup on our list is one of the most commonly ordered tests for seniors, and yet it comes with one of the highest rates of false alarms and dangerous follow-ups. Number 3, cardiac stress test. This test is one of the most common and frequently prescribed heart checkups for seniors, especially for those who experience mild fatigue, occasional chest tightness, or a general feeling of slowing down. On the surface, it sounds like a logical test. It monitors how your heart responds to exercise and checks for signs of blocked arteries. But here's what most seniors don't realize. After age 70, a cardiac stress test can do more harm than good, especially if you don't have clear heart disease symptoms. What is a cardiac stress test? A stress test is designed to see how your heart works under pressure. Typically, you walk on a treadmill or ride a stationary bike while your heart rate, blood pressure, and breathing are closely monitored. In some cases, if you're unable to exercise, medications are given to simulate the effects of exercise on your heart. Doctors use these tests to detect coronary artery disease or check for irregularities in blood flow. Sounds sensible, right? The problem lies in the accuracy of the test for older adults. The false positive rate, meaning the test says there's a problem when there isn't, can be as high as 40% in adults over 70. This means nearly half of the seniors who take this test may be told they have heart trouble when their heart is perfectly fine. A false positive result isn't just a harmless mistake. It often sets off a chain reaction of unnecessary procedures and risks. Follow-up angiograms. A procedure where a catheter is threaded into the heart's blood vessels, exposing you to contrast dyes that can harm the kidneys, especially if you're over 70. Unneeded stents or bypass surgeries. Studies show that many seniors undergo these procedures after stress test referrals, even when there's no real blockage threatening their life. Increased risk of complications. Invasive procedures come with the danger of bleeding, infection, stroke, and prolonged recovery times, all of which can severely impact an older adult's quality of life. A 2017 study published in JAMA Cardiology revealed that more than half of all stents placed after stress test referrals provided no improvement in survival or quality of life for the patients who received them. In other words, they went through risky procedures that did nothing to make them live longer or feel better. To see how this plays out in real life, let me share the story of Leonard, a 73-year-old retired mail carrier. Leonard stayed active. He walked every day, kept his weight healthy, and enjoyed playing with his grandchildren. During a routine checkup, he casually mentioned to his doctor that he sometimes felt tired walking up hills. Out of caution, his doctor scheduled a cardiac stress test. The results of the test were unclear, which immediately led to a catheterization procedure, a test where a tube is inserted into the arteries to look for blockages. Doctors found a mild narrowing in one artery and decided to place a stent, even though this narrowing posed no immediate threat. But that same night, Leonard suffered a reaction to the contrast dye used during the procedure. His kidneys were injured, and he spent 6 days in the hospital, all for a problem that wasn't truly a heart issue. His original fatigue? It was simply due to mild dehydration and not eating enough protein. This story is far too common. Many seniors, like Leonard, are swept into a cascade of medical interventions because of a test that may have been unnecessary to begin with. If you are experiencing classic symptoms of heart disease, like sharp chest pain during activity, severe shortness of breath when exerting yourself, or sudden unexplained fatigue that doesn't improve with rest, a stress test might still be valuable. But for seniors who simply feel a little tired or out of breath on occasion, especially those without a history of heart disease, there are safer and smarter alternatives. Resting electrocardiogram, EKG. This test checks your heart rhythm while you are still and relaxed. It's non-invasive and can quickly rule out major electrical issues. Coronary calcium scan. This low radiation imaging test looks for calcium buildup plaque in your arteries. It's faster, safer, and more accurate in predicting heart disease risk for seniors than a treadmill stress test. Blood tests for inflammation and heart health. Simple tests, like high-sensitivity C-reactive protein, hsCRP, can help assess your heart risk without sending you down the path of invasive procedures. Lifestyle-based heart health checks. Sometimes the best test is a careful look at your daily habits, your diet, exercise, stress management, and sleep, because these factors are far stronger predictors of heart health than any treadmill reading. If your doctor suggests a stress test, don't be afraid to ask, what happens if this test shows something abnormal? Will the results change how we treat my heart health? Are there non-invasive tests we can try first? Doctors often respect patients who take an informed, proactive approach to their care, and asking these questions might save you from a series of unnecessary and risky procedures. The cardiac stress test may sound harmless, but after 70, its risks often outweigh its benefits. If you're active, feeling mostly well, and not experiencing classic heart disease symptoms, start with simpler, safer assessments. Focus on what truly protects your heart, daily movement like walking or gentle swimming. A heart-healthy diet, rich in vegetables, lean proteins, and healthy fats. Stress management techniques like meditation or breathing exercises. Routine monitoring of blood pressure, cholesterol, and blood sugar. Remember, no machine can replace the power of consistent, healthy habits. And as we'll see next, there's another test, one you've probably heard of, that is far riskier for seniors than most people realize. Because the next checkup, number 2 on our list, is something almost every senior has faced, and it can bring more harm than good if you're over 70. Number 2, colonoscopy. This one might surprise you. Colonoscopies are often considered the gold standard for detecting colon cancer early. Doctors recommend them as part of routine preventive care, and for many younger adults, they are indeed valuable. But here's what most seniors over 70 aren't told. The risks of colonoscopy rise sharply with age, often outweighing the benefits, especially after 75. A colonoscopy involves inserting a flexible camera into the colon to look for polyps or abnormal growths that could turn cancerous. While the procedure might sound routine, it's far from risk-free, particularly for older adults. Here's why. Harsh preparation. The strong laxatives used to empty the bowels can cause severe dehydration, electrolyte imbalances, dizziness, and even kidney issues in seniors. These pre-procedure side effects alone can send some older adults to the emergency room. Sedation risks. The anesthesia or sedation used during the procedure can affect brain function in seniors, sometimes causing confusion, memory issues, or delirium that can last days or even weeks in those who are vulnerable. Physical risks. The scope can occasionally cause tears or perforations in the colon wall, which can lead to serious complications like internal bleeding or infections requiring emergency surgery. Heart and lung strain. In seniors with existing heart or lung conditions, sedation can put added strain on these systems, increasing the risk of dangerous complications during or after the test. A 2019 study published in JAMA Internal Medicine analyzed over 1.3 million Medicare patients aged 70 and older who underwent colonoscopies. The findings were sobering. For every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved from cancer. In contrast, over 20 people experienced serious complications, including hospitalizations, infections, and bleeding. That's a 10-1 risk-to-benefit ratio, which means for every life potentially saved, 10 other seniors endured harm that might have been avoided. And here's another important point. Many polyps found in older adults are small, slow-growing, and unlikely to cause harm during the senior years. In some cases, removing them may cause more trauma to the colon than simply leaving them alone, especially when the procedure leads to bleeding or perforations. Consider the case of Lillian, a 70-year-old grandmother and retired teacher. Lillian had no symptoms, no blood in her stool, no digestive problems, and no family history of colon cancer. She'd already had 2 clean colonoscopies in the past, but during a visit with a new doctor, she was strongly urged to get another one, just to be safe. During the procedure, a small polyp was removed. That night, Lillian experienced intense abdominal pain and fainted. She was rushed to the hospital, where doctors discovered a bowel perforation caused by the scope. Lillian spent 9 days recovering in the hospital, lost 10 pounds, and took months to regain her strength. When we reviewed her case, we found there was absolutely no medical reason to repeat that colonoscopy. Her previous clean results and low-risk history meant the test offered almost no benefit. The U.S. Preventive Services Task Force, USPSTF, recommends stopping routine colon cancer screening at age 75 for most people unless there are specific symptoms or a very high risk, like a strong family history or genetic conditions. For seniors in good health, colonoscopies may still be considered up to 75, but after that, the balance tips heavily toward risk. If you are 70 or older and your previous colonoscopies were clean, you may not need another invasive screening. The key question to ask your doctor is, if you find something small, what will we do about it? Will the treatment help me live longer or feel better, or could it make things worse? Thankfully, there are non-invasive screening options that are far safer for seniors. FIT test, fecal immunochemical test, a simple at-home test that detects hidden blood in stool, which can indicate polyps or cancer. It requires no prep, no sedation, and has been shown to catch most cases that colonoscopies detect. Stool DNA tests, like Cologuard. These tests check for abnormal DNA markers linked to colon cancer. They're more accurate than FIT tests and can be done from the comfort of your home. CT colonography, virtual colonoscopy, a less invasive imaging test that requires less prep and no sedation, though it still carries a small radiation risk. These alternatives are particularly valuable for seniors who want peace of mind without the risks of anesthesia, dehydration, or invasive instruments. Colonoscopy is a powerful tool in the right circumstances, but more is not always better, especially after 70. Many seniors are encouraged to continue screening out of habit, not because it will improve their quality of life. The goal at this stage of life should be maintaining comfort, independence, and overall health, not chasing numbers on a medical chart. If you're over 70, and especially if you've had clean colonoscopies before, it's time to ask whether the test is still worth it. The risks of complications, hospital stays, and lingering side effects may outweigh the chance of catching a rare, slow-growing polyp. Instead, talk to your doctor about non-invasive options like the FIT test, which is safe, accurate, and easy. And most importantly, focus on colon health through lifestyle. Eat a fiber-rich diet with vegetables, fruits, and whole grains. Stay hydrated, and keep your gut healthy with fermented foods or probiotics. Maintain regular bowel habits by staying active and avoiding chronic constipation. Don't get trapped in the screening pipeline just because it's what you've always done. Smart, individualized care will protect your health better than unnecessary procedures. And now, we've reached the #1 checkup on our list, the one that's not only overused, but also incredibly harmful for seniors. It's a test that exposes your body to dangerous levels of radiation and has been linked to cancer. Let's talk about why you should think twice before ever agreeing to this so-called preventive test. #1, annual full-body CT scans. This is by far the most overused and potentially dangerous preventive checkup offered to seniors. It's often marketed as the ultimate health safety net, a high-tech scan that promises to catch cancer or other life-threatening conditions before they become serious. Private clinics and executive health programs promote it as a way to see everything inside your body in just minutes. But here's the truth. Full-body CT scans often do far more harm than good, especially for adults over 70. A CT scan, or a computed tomography scan, uses a series of X-rays and powerful computer imaging to create detailed cross-sectional pictures of your organs, tissues, and bones. A full-body CT scan goes even further, capturing your chest, abdomen, pelvis, and sometimes even your head, exposing your body to very high doses of ionizing radiation. How high? A single full-body CT scan exposes you to 10 to 20 millisieverts of radiation, which is roughly equivalent to 500 chest X-rays or 70 mammograms. That's a staggering amount of radiation, and repeated scans year after year can accumulate to levels that significantly increase cancer risk. In fact, a 2023 modeling study published in JAMA Internal Medicine estimated that up to 5% of all cancers in the U.S. may now be linked to medical imaging, especially CT scans. To put that in perspective, Connecticut's related cancers are on par with cancers caused by daily alcohol consumption. So while these scans are marketed as life-saving tools, the reality is that they can quietly raise your cancer risk over time. The trap of incidental findings. The biggest danger of a full-body CT scan is not just the radiation, it's what happens after the scan. These tests often detect tiny nodules, cysts, or calcifications that are completely harmless and simply part of normal aging. However, once a scan picks up these incidental findings, doctors are obligated to investigate further. This sets off a chain reaction. More scans, more radiation. Each follow-up scan adds to your total radiation dose. Biopsies or invasive procedures. A harmless nodule might be biopsied, which can puncture the lung, liver, or other organs, leading to complications. Unnecessary surgeries. In some cases, a benign finding leads to surgical removal of tissue, procedures that carry far greater risks for older adults. This cycle of fear-driven follow-up is sometimes referred to as overdiagnosis, finding and treating things that would never have harmed you in the first place. For seniors, these unnecessary interventions can lead to hospitalizations, infections, and a loss of independence. Take the example of Vincent, an active 75-year-old retired pilot. He felt great. He exercised daily, ate well, and had no major health complaints. As part of a private elite senior checkup program, Vincent underwent a full-body CT scan. The scan revealed a tiny 3 mm nodule in his lung. His doctors told him they couldn't rule out cancer, so they ordered a PET scan. That scan suggested further investigation, so Vincent underwent a needle biopsy. The result? The nodule was completely benign, but the biopsy caused his lung to collapse, leading to a 2-month recovery and weeks of pain, all for something that never needed treatment in the first place. Vincent told us later, "I went in feeling perfectly healthy. I left with a hospital stay, fear, and months of recovery. If I could go back, I'd never have agreed to that scan." Despite the promises, there is no scientific evidence that routine full-body CT scans improve survival rates in healthy, symptom-free individuals. Major medical organizations, including the American College of Radiology, strongly advise against using these scans for general screening. Their statement is clear: the potential harm outweighs the benefits. These scans can detect abnormalities, yes, but most are benign. And because CT scans can't distinguish between harmless and dangerous findings, they often lead to invasive and stressful follow-ups that don't improve your health or your life expectancy. This doesn't mean all scans are bad. Targeted imaging can save lives when there are real symptoms. If you're experiencing signs like unexplained weight loss, persistent pain in a specific area, coughing up blood, or visible swelling or lumps, then a focused CT scan of just the chest, abdomen, etc. may be helpful and appropriate. The key difference is targeted testing, not scanning your entire body just in case. Instead of a full-body CT, consider regular physical checkups with your primary doctor. Simple blood tests and physical exams can catch many health issues early, ultrasounds or low-dose scans. When imaging is necessary, these options involve much less radiation. Healthy lifestyle habits, diet, exercise, and good sleep are proven to prevent far more diseases than any scan can detect. Before you agree to a CT scan, or any scan, ask your doctor, what are we looking for specifically? If the scan shows something abnormal, what will the next steps be? Is there a less invasive test we can try first? The answer to these questions will often reveal whether the scan is truly necessary or just routine. Full-body CT scans are not preventive care. They are overkill. For seniors over 70, they carry real risks: high radiation exposure, unnecessary anxiety, and the potential for harmful procedures that do nothing to improve health outcomes. Your time, energy, and health are too valuable to waste on fear-driven testing. Trust your body's signals, focus on healthy habits, and ask for targeted scans only when there's a clear medical reason. Sometimes less truly is more. Now that we've uncovered the 5 checkups you should avoid after 70, let's bring it all together with some key takeaways. And I'll ask for your thoughts and experiences because what you share might help another senior make a life-changing decision. So there you have it. 5 health checkups that may seem routine or harmless, but can actually do more harm than good once you're past 70. We've covered the bone density scan that can lead to fear-driven medications, the brain MRI that often causes unnecessary panic, the cardiac stress test with its high rate of false alarms, the colonoscopy that carries rising risks as we age, and the full-body CT scan that can quietly increase your cancer risk. Each of these tests, while helpful in the right circumstances, can become harmful when done out of habit rather than need. One of the hardest things to accept about modern medicine is that more doesn't always mean better. Sometimes, especially after 70, the safest and smartest thing you can do is pause, ask questions, and focus on what truly keeps you healthy. It's not about skipping every test. It's about making informed choices that balance the benefits and risks. Think about it this way. If a test comes back with something abnormal, what's the next step? Will this test improve your quality of life, or will it lead you down a path of anxiety, invasive procedures, and hospital stays? Am I being tested because it's necessary or because it's just routine? As we age, prevention isn't about finding every tiny imperfection in the body. It's about strengthening the foundation, your muscles, your heart, your immune system, your mind, and your daily habits. These matter far more than a single number on a screen. The real prevention starts with you. The truth is, the most powerful checkups you can do don't require machines. They involve daily movement, walking, stretching, and balance exercises to prevent falls and keep your body strong. Eating nutrient-rich foods, plenty of vegetables, lean proteins, omega-3s, and foods high in calcium and vitamin D. Maintaining mental sharpness, reading, puzzles, learning new hobbies, and staying socially connected. Rest and recovery. Deep, restful sleep and stress management, which are vital for brain and heart health. Medical tests should be tools to guide care when there's a real concern, not triggers for fear or unnecessary treatment. Now, I want to hear from you. Have you, or someone you love, ever faced complications from a medical test or procedure that turned out to be unnecessary? Did a test ever lead you to take medications or treatments you later regretted? Or have you had a positive experience where a doctor told you you don't need that test and it saved you stress and money? Your stories and questions are powerful. We read every single comment and reply with personalized advice whenever we can. So share your thoughts in the comments section below. You might just help another senior make a better decision for their health. If you found this video helpful, please hit the like button. It takes just a second, but it helps this video reach more seniors who desperately need this information. Also, don't forget to subscribe to our channel, Trusted Senior Health, and tap the notification bell so you never miss our latest videos. We post science-backed, doctor-reviewed content every week, covering topics like joint strength, brain health, nutrition, and heart safety, designed specifically for seniors who want to stay healthy, strong, and independent. Modern medicine is powerful, but it's not perfect. Sometimes the best thing you can do is ask the right questions, avoid unnecessary interventions, and focus on the habits that keep your body and mind thriving. Remember, you are not defined by test results. You are defined by how you live, how you care for yourself, and the choices you make every day. So stay active, eat well, sleep deeply, and choose your checkups wisely. And as always, thank you for watching Trusted Senior Health. We're honored to be part of your journey toward a healthier, happier life after 60.